Let's talk about gestational diabetes. It is a type of diabetes that develops during pregnancy, usually in the second or third trimester, and goes away after childbirth in most cases. It happens when the body can't produce enough insulin to meet the extra needs. The main cause of gestational diabetes is hormonal changes during pregnancy, which makes it harder for insulin to work properly. In this case, pancreas can't produce enough insulin to overcome this resistance. Risk factors. You are more likely to develop gestational diabetes if you are over 25 years old, overweight or obese before pregnancy, a family history of diabetes, when you already had gestational diabetes in a previous pregnancy, previously delivered a large baby, over 9 lbs, 4 kg, have polycystic ovary syndrome, PCOS. Symptoms. Often gestational diabetes has no noticeable symptoms, but sometimes you may experience increased thirst, frequent urination, fatigue, blurred vision. Because these symptoms can also be normal in pregnancy, routine screening is essential. Diagnosis. Usually tested between 24 and 28 weeks of pregnancy using glucose challenge test, GCT, oral glucose tolerance test, OGTT. Gestational diabetes can lead to complications if untreated. For the babies, it can lead to high birth weight, macrosomia, low blood sugar after birth, breathing problems, higher risk of obesity or type 2 diabetes later in life. For the mother, high blood pressure or preeclampsia, increased risk of cesarean delivery, higher chance of developing type 2 diabetes later. Management of the gestational diabetes includes healthy eating, balanced meals with controlled carbohydrates, regular physical activity, walking, swimming, or prenatal exercise, blood sugar monitoring, as advised by your doctor, medication if needed, insulin or oral medicine, only if diet and exercise aren't enough. Blood sugar levels usually return to normal. A follow-up glucose test is done 12 weeks after birth. Continue healthy habits to reduce future type 2 diabetes.